Hello and welcome to our COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello, Minister. Okay, so good morning. Let us begin this morning with the latest developments in our fight against COVID-19. I understand yesterday we would have received the field hospital from Qatar. Now, kindly explain to us, what does this mean in terms of our capacity from a medical standpoint?
Well, first of all, we are very happy to receive this donation from Qatar. As you know, His Excellency President Ali and the Emir of Qatar had some very productive bilateral discussions sometime last year. And one of the things that they discussed is how to assist Guyana in its fight against COVID. And so what we're seeing, or what we saw yesterday, the arrival of this field hospital, was part of that agreement between the President and the Emir. So we're very grateful that we have been able to receive this hospital. The field hospital, as we understand, it has 60 beds, and we would be able to manage patients, both critical and non-critical patients. 20 of the 60 beds would be like ICU beds. It would have monitors, it would have ventilators, so that we'll be able to manage patients who have a more severe or critical form of COVID. So with this donation alone, it would really boost our capacity to manage severely ill and critically ill patients. Currently, our capacity at, say, the Oceanview facility is about 25 for critically or severely ill patients. And by adding another 20 bed of ICU care, that would take it up significantly, almost double it. So we're very pleased with this donation, and we'll be working to set it up very quickly.
Okay, Minister, I understand you said that this facility would be set up at the West Demerara Regional Hospital. Now, can you say whether it's being set up by locals or officials from Qatar?
No, the facility, we would be setting it up. Of course, we'll get guidance and the instructions on how to do so. We have been thinking about where we want to set it up. Initially, we were thinking about the West Demerara Hospital because we went there, we identified the space and so forth. But upon closer analysis of the amount of personnel that we have there to run the facility, it would be a challenge, both in terms of nursing personnel and in terms of doctors. So what we have decided, because we already have a lot of capacity in terms of personnel at Oceanview, that we think it might be more appropriate for us to set it up in the compound of the Oceanview facility, and it would complement what we are doing at Oceanview, because we have already built in some diagnostic infrastructure and some other things that can complement this particular hospital. So we would be shifting the location to Oceanview. In terms of its actual setting up, I think our technical people here, the engineers and so forth, would be able to do that with, of course, the guidance from the Qataris.
Okay, Minister, for clarity, remind us again, what's the staff complement like at Oceanview currently?
There are quite a lot of people, and it depends on the shift. So we have doctors, we have pharmacists, we have nurses, we have physiotherapists. So there are quite a large complement of people. In addition to that, you have administrators and other ancillary types of staff.
Okay, Minister. I know the agreement for the facility was between the President and the Emir of Qatar, but was there any cost attached to this facility?
We don't have a specific cost, but I would imagine from what I saw there, it's probably in excess of $1 million US, but that would be speculating. Okay. I think it's quite expensive.
Okay, and I know the discussions last year, it would have been focused on a number of things, and would we be seeing any other medical support coming from Qatar? Any other arrangement or agreement?
I'm sure the relationship would be strengthened over time and evolve. As you know, the president also had announced that Guyana would be setting up an embassy in Qatar. So I think all of this would help to strengthen our relationship. And certainly in the area of health, we expect that our relationship would grow stronger as well.
Okay, Minister. Now let's turn our attention a little bit to the education sector. It's been about 2 weeks since we've reopened schools, and a few teachers were tested positive for COVID-19. Can you give us an update on the current testing and results at this time?
Well, the initial spikes that we have seen with teachers and students coming into the facility, that's because they were coming back from their community into a dormitory setting. And at that point, when we did testing, we found about 15 teachers who were positive, another 15 or so staff members. These are the cooks and other people who were positive. And we also had a number of students who were positive. As of now, more than 2 weeks would have elapsed, and because all of these people have been asymptomatic, they were put in isolation, they were monitored, they did not get signs or symptoms of COVID, and therefore most of them would have been discharged. So because they're not going back and forth, but they're more confined to that dormitory space, I think more or less most of those cases now would have resolved themselves.
Okay, Minister. And can you say if contact tracing, because I know the ministry was engaged in that, were the efforts a success to?
Well, we do, when we get a positive case, we do try to go through who were the contacts, and based on that list that is generated, we try to go out and trace people. And that has been our modus operandi, so we continue to do that. And in the case of both teachers and the staff, the Ministry of Education and students, we have done quite a lot of that as well.
Okay, now before we come off of this, can you at this point give a regional breakdown of students and teachers who were infected in each region?
At that time, when we did the analysis, there were 15 teachers, 15 staff members, and that would work out on average maybe 1 or 2 people per region.
Okay, Minister. Thank you for that. Now, wrapping up, I know we are currently monitoring several areas around the country. Now, let's start with Oriala and Siberut in Region 6. I know previously there were some measures that were put in place to ensure the cases were reduced, but now we've seen more cases emerge over the past couple of days. Can we have an update?
Oriala and Siberut, in every community, you're going to see cases go up and down. Yes, indeed, a couple of weeks ago we did have a spike in Oriala, and we have seen a corresponding spike in Siberut. And we had taken some measures basically to restrict movement and to work with the people there and so forth, and we saw that coming down. We have a few cases now. It's not that alarming, but there are a few cases, and therefore we have to take precautions, and we have to do the education and remind people to do social distancing and wearing masks and so forth. But we are monitoring it. The regional task force in Region 6 has been working and monitoring that. Similarly, in Maracaibo, you know that's an area that we've had a challenge in Region 5. And we now have sent in a team comprising of doctors and nurses, and they're going to be based at Maracaibo for a couple of weeks. And hopefully they would be able to work with the community and do some more testing. And we hope this time around that we'll get more cooperation. We believe by having the doctor kind of embedded there, that we would see better results. And we continue to talk to the village leaders to ensure that they understand what we're trying to do. So hopefully we'll probably see some more cases as we do more testing, but eventually we'll be able to see those numbers come down. We have a number of cases in New Amsterdam as well, and that has been something that we've been monitoring. There are about 36 cases in New Amsterdam. Those persons have been identified. They're in self-isolation, and we continue to monitor them. We have had in Warramadong, we have had 10 cases, and here again, we have sent in a team, and that team is currently in the village. They've been doing some sensitization with the community, because in a lot of these communities, people are not wearing masks. And if you have positive cases, then they will be in contact with the positive cases. So now that we've identified the 10 positive and isolate them, we are now working with the community to sensitize them, and we'll be doing some more testing over the next couple of days. We have also seen a number of cases in Paramakotoy and in Madhya. Again, we have been monitoring them, and we'll see how that develops. But we have our medical team on hand who have been checking and monitoring.
Okay, thank you so much for that, Minister, and thank you for your time today. This has been DPI's COVID-19 update. For more information, visit our website dpi.gov.gy or our social media platforms.